Okay, so I just wanted to talk a little bit about steroids. So, prednisone, Medrol, I've taken both. Um, they use this for a lot of autoimmune disease. Sometimes, if like you have negative antibodies, then they will use steroids to see if you respond, and if you do respond, then that would warrant further treatment with like Plaquenil or hydroxychloroquine. At least that's how they did things with me. I've talked to other lupus patients that experience this, that they see if you respond to steroids before moving on to further or more aggressive treatments or diagnosis. But that's just my experience. I'm not a doctor or a nurse. I'm just a patient. So, when I first started having really severe symptoms and just more disease activity, I would have to go into the ER. Someone would have to carry me into the car. I'd have to go to the ER. They would have to put me in a wheelchair so that I could get IV steroids in the emergency room because I could not even walk. It wasn't just joint pain, it was that my muscles felt that weak. I couldn't even walk. And it still happens sometimes, not as severe, but it has been happening since I've been off the Benlysta intermittently. It's not constant. Again, it's not as severe as it was when I first got sick before I was even on Plaquenil or, any of that stuff, but it does still happen to the point where it can be debilitating intermittently. It doesn't last too long. It's still not pleasant. So, I had been maintained on Plaquenil and Prednisone for over a year. It was pretty bad. I ended up in the ER with a low white count because of it, because it was a high dose of Prednisone too. Because Plaquenil wasn't enough, and they were refusing more aggressive treatment at that time. I think a lot of new research has come out in regards to ANA negative patients, but back when I was diagnosed, I think it was 2016 or early 2017, I don't think there was as much information or as much treatments as there are available now. Like Benlysta certainly wasn't available. So basically, I, at this point, try to reserve using steroids for acute situations. Like, I will suffer for weeks before I'll agree to take steroids. I don't like taking them. So, whether that's a Medrol dose pack, which you take 4 4-milligram pills, then 3, then 2, then 1 to like kind of taper off them. The problem is, what I experience is the minute that you stop taking them, when you're down to like 1 pill, like the next day you start feeling terrible again. I don't really appreciate that. I don't see the point. I feel like that's like putting a Band-Aid on a bleeding artery, I'm sure in certain acute situations it's necessary. I've had to do it plenty of times where it certainly was necessary and maybe got me out of a pretty bad funk after having to come off Benlysta. I was not doing too good, and I have had to do that a number of times. I also had a really nasty reaction to methotrexate that they tried to put me on, which I'll do a separate video about that. It was a disaster. And I had to take, I think, 2 Medrol dose packs to like get out of this. It was crazy, the side effects what this methotrexate did to me. But so I understand that it's certainly needed in acute situations or flares that are really bad. But long term, there's a lot of side effects, and I think there's a lot of side effects that they don't tell you. It causes adrenal problems. You just Google it because they don't tell you these things when they're trying to tell you to take them. And yeah, just do your own research before they try to hand you a bunch of steroids and send you on your way. Oh, here's just Plaquenil and some steroids. Like, if your disease is bad enough that you consistently need steroids, then I don't know, maybe Plaquenil isn't doing it. So this is what they did to me for a long time. I'm on certainly a lot more treatment than that at this point, and I don't usually have to mess with steroids. The side effects, there's a lot. Okay, there's a lot. First of all, I've been off Benlysta for a while. It's been causing lots of problems. It just seems like once your body's, I don't know how to explain, like once your body gets kind of used to like, oh, this is nice, I'm working properly, and then you take that away, it's just like full resistance, like all hell breaks loose. So I recently just had to come off steroids. Thank God I'm going back on the Benlysta, but you can see like the moon face, like my face is puffy and swollen. I did 2 other videos that I uploaded today. I mean, you can see it. It sucks. It's not pleasant. What am I gonna do? You know, there's nothing I can do about it. It is what it is. But this is why I avoid it at all costs. You'll also, well, I get random, really intense abdominal pain. It makes me extremely agitated. Like, the roid rage is real. Like, I'm very, very irritable. I'm just not a good person on steroids. And you can't help it. You're just so irritable. Now, I know that everyone doesn't experience this side effect, but I know a lot of people that do. And it's not pleasant for the person who's feeling constantly irritable either, you know. But it's certainly not pleasant for the people around you that have to helplessly deal with you being a bitch on wheels, basically. So, I don't know, it's just things that we deal with. So yeah, I try to reserve steroids for absolute emergencies. Like, I'm really not feeling good, it's been weeks and I can't do this anymore. Like, I can't take it anymore. It's probably not a good thing that I do that, but I just don't feel like the side effects are always worth it. Sometimes you have to, but I'd rather not. I can't stress this enough. Like, I strongly suggest before you let anyone put you on steroids for a long period of time for autoimmune disease, like, do your research, advocate for yourself, because these doctors have how many other patients, and they just need to move about their day, and you know, it's a business, basically. I hate to say it, it sucks that it's like this, but it's a business, you know, and they are not the ones that have to go home and deal with these side effects. So you absolutely need to advocate for yourself, because chances are your doctors won't. Most of it. This has just been what I've dealt with. No one was like, oh, here, take these steroids. And by the way, it can cause adrenal fatigue and blah, 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 blah. No one said that, okay? No one's going to say that. They're not going to tell you that. So just be careful. I don't mean to be pessimistic. Like I said, sometimes you have no choice. It is what it is. But I'm just giving you the cold, hard truth. So I hope this was helpful. And I know that I keep my videos pretty short and to the point. I just don't see any reason to go on, and everybody has lives and, you know, things that they're doing, and doesn't have time to sit here and watch a half-an-hour video. So, I will start making longer videos about different things, but I just don't feel like I need 20-30 minutes to talk about what steroids do to you. Anyway, I'm going to be making more videos, probably about medication and other things, so please subscribe if you haven't already so that I can keep putting this content out. Thank you for watching, guys.